This topic is factors affecting fetal development. Let's first talk about some of the things we expect to see with fetal development. Average gestation from time of fertilization is 10 lunar months. The term lunar month refers to a 4-week segment, 28 days. Notice this parallels the 28 days of an average menstrual cycle. It adds up to 40 weeks or 280 days. During this time, there are 3 stages of fetal development. You can see some of this in the image. We will use this image throughout our discussion. Also note that the bars in the image show when each organ is most sensitive during development for structural and functional anomalies. Pre-embryonic stage. This is considered the first 14 days after conception. Pre-organogenesis. This is the period of time before actual organs are formed. Cells are multiplying. Cellular multiplication starts as the zygote is traveling through the fallopian tube. You can see this in the image. The zygote begins a period called cleavage. This is when quick meiotic divisions occur. By days 4 or 5, blastocyst formation is completed as it enters the uterus. Blastocyst implantation into the uterine lining occurs by day 12. Now let's talk about the embryonic stage. This is from day 15 through 8 weeks. This is when organogenesis happens. All major systems are developing. The cells begin to differentiate into the vital organs. For example, the heart begins functioning at 4 weeks. The primitive red blood cells are starting to circulate through the chorionic villi and fetus. You can see in the image when the other organs are forming. And again, remember that darker pink shows the time that those organs are most sensitive to developing structural anomalies. And the light pink shows the less sensitive period, but defects during that time result in functional anomalies. During this stage, the external features begin developing. Now, because so many things are taking shape and developing during this stage, this becomes the most vulnerable stage to the effects of teratogens, which are any substance or thing that has the potential to interrupt normal development of structures in the embryo. And this is the time that major congenital anomalies can happen. The fetal stage starts at the end of week 8 and continues until birth, which you can see in the image. All of the organs and external structures that are in a full-term newborn have developed. And this stage is for the fine-tuning of those structures and optimizing their functions. Between 9 to 12 weeks, fetal heart tones are heard with a heartbeat of about 110 to 160 beats per minute. Gender can be determined by blood test after 9 weeks, and at about 12 weeks, an ultrasound may be utilized for this. At 20 weeks, the fetus is active and fetal movement may be felt by the mother. This is called quickening. From 25 to 28 weeks, even though the lungs are still immature, they are able to begin gas exchange. 35 to 36 weeks, it is possible for the fetus to survive outside of the placenta. They may need some specialized care, but the chance of survival is good. And at 39 weeks, the fetus is considered full term. Factors influencing congenital malformation. Quality of sperm or ovum. If either of these is inferior, the zygote that is formed will also be inferior. Genetic code. If there is a flaw in the genetic code, maybe a genetic disorder, that will affect the developing fetus because it will be passed on to the fetus. If any of these are affected during cell multiplication and differentiation, every cell of the zygote is affected. If the maternal environment is unfavorable, the zygote cells may die, the embryo may be affected, or spontaneous abortion could take place. This includes poor nutrition. It may cause neural tube defects and affect the developing brain. Poor maternal nutrition may also affect the diseases a child may develop later in life as an adult. Infections, like rubella in the first 12 weeks of gestation, can cause severe defects and death of the embryo. Radiation may cause fetal death and defects of structures and organs. This is dependent upon what developmental time the fetus was exposed and how much exposure occurred. And teratogens. Let's look at these more closely. Teratogens are hazardous agents that cause fetal abnormalities. Fetal harm is dependent upon exposure. When was the fetus exposed? We've discussed that during the embryonic stage, the organs are developing and are most sensitive to the damaging effects of teratogens. Harm is also dependent upon what teratogen the fetus was exposed to, and what was the dose and duration of that exposure. You can see an example in the image of a fetus exposed to alcohol while in utero, resulting in learning disabilities and facial anomalies. Teratogens may cause malformations of the heart, limbs, eyes, and other organ systems. Client teaching. Educate clients about key developmental milestones, that fetal heartbeat between the 8 and 12 weeks, sex from 9 to 12 weeks with blood or ultrasound, and by 16 weeks the sex can normally be clearly seen via ultrasound. When fetal movement is expected, quickening at about 20 weeks. Hair presence. At 20 weeks, eyebrows and eyelashes are starting to grow, and woolly hair may be seen on the head. By 24 weeks, the scalp hair is growing longer and the eyebrows and eyelashes are formed. Eye opening and breathing by 28 weeks. Educate the client about healthy nutrition. We know that can impact the developing fetus and have lifelong effects. And also about teratogens to avoid: alcohol, tobacco, nicotine, and cigarette smoke. Some medications. Encourage the client to discuss their pregnancy with all healthcare providers. Recreational substances like cocaine and heroin, and hyperthermia, like in saunas.